Well, this morning I'm delighted to be able to introduce the Right Honourable Matt Hancock, who's our Secretary of State for Health and Social Care. Matt's going to talk with us, and then we'll have an opportunity for questions and answers. So can we welcome our Secretary of State?
Thank you very much indeed, and good morning. And it's absolutely terrific to be here with you in this wonderful theatre. It's refreshing to be in a building where everything works and everyone gets on with each other. Do you? They tell me that the construction work here is, when it's completed, the new Warwick Arts Centre is going to have more space and more facilities and be more accessible. Essentially, it'll be bigger, better, and fit for the future. And today I want to talk about how we make public health bigger, better, and fit for the future, and what we need to do to build on our successes. And we've had some huge successes that need to be celebrated, but also the work that we still need to do and the challenges and opportunities for the next decade. I believe that the 2020s are going to herald a fundamental shift in the way that we think about health, especially public health. Proactive and predictive, personalized prevention. That's the future of public health. And I'd like to start with a story of a great British victory against the odds. Don't worry. This one's not about Brexit. It's the story behind Team GB's complete and utter domination of elite cycling. Now, in 2002, the British cycling team had won just one solitary Olympic gold medal in its entire 76-year history. But over the next decade, they won 8 gold medals at 3 Olympics. They transformed British cycling from an international laughingstock to the world leaders that everybody wanted to imitate. And they did it through the theory of marginal gains. What they did, Team GB worked out that if you broke down all the constituent parts that go into elite cycling, and if you can improve each one by just 1%, and then add all of that together, then that's your margin of victory. And that's how you achieve success. Now, I use this example because the whole story of public health is one of these incremental marginal gains. We've always been driven by data, and we must continue to be driven by the data and make decisions based on evidence, whether it's on sugar or vaccination or opioids, 3 things that I want to return to. Because the other reason I use the example of cycling is because public health is also made up of so many constituent parts. National government, local authorities, the NHS, employers, and, most importantly, individuals, the citizen. Now, of course, funding is important, and I will always fight for fair funding for health and social care, and I'll always fight for local government, like we did in the spending round, because nobody knows your communities and their needs better than you. But public health is about so much more than just the public health grant. It's about the whole system working together and traveling in the same direction. Because let's look at the successes of the last generation. A lot of the easier stuff's been done. And many of you in this room have played your part in making it happen. On smoking, on immunization, on HIV, even on clean air. The way forward in these areas is to continue to drive those marginal gains, constant improvements, hard-fought progress that we mustn't ever go back on, and we've got to keep pushing together. Thanks to concerted efforts on smoking, for instance, both legislation and education, we now have one of the lowest smoking rates in Europe. 50 years ago, 1 in every 2 adults smoked. Now, fewer than 1 in 6 adults smoke. Yet for the 14% of adults who do still smoke, it's the leading cause of illness and early death, and we know the less well off you are, the more likely you are to smoke, exacerbating existing health inequalities. So how do we get that 14% closer to zero? Our Prevention Green Paper set an ambition for England to be smoke-free by 2030, and I believe that we can get there. 10 years to get people to give up cigarettes or switch to less harmful alternative. It's a big ask. I'm confident we can do it, but we have to work together to get there. Through a proactive approach to prevent young people from taking up smoking in the first place, through to personalized support to help persistent smokers to kick the habit. This sort of personalized prevention must be the guiding principle to where we make the big advances in public health in the 2020s. And to achieve it, we need to harness the predictive power that we increasingly have right across the board, including in some new and very exciting areas, like genomics. And I know there have been sessions on the power of genomics at this conference. And genomics on its own isn't nearly as powerful as genomics linked to the data crunching power of artificial intelligence, so we can understand the insights of this huge new capability to understand the data that underpins every single one of us, and therefore help get to people before they have a problem and prevent bad luck or bad choices leading so often to bad outcomes. And getting this right and getting the philosophy right about the use of genomics, both whole genome sequencing and partial, is critical. And we're going to try to underpin the overall approach we have with this more personalized prevention. That's the approach that we're taking to the review of the NHS health checks program, for instance. Not to scrap it altogether or remove it. There's long been a debate about whether the health checks are good value for money. But instead of either having this binary debate, should we have them or should we scrap them, instead, we can improve them by using the power of technology and data to target people more effectively and make sure that the money that we spend gets better targeted. Now, of course, when it comes to clean air, that's a global challenge. It requires a global response, as well as the local response in each area. We've taken a global lead with the Clean Air Strategy that we launched earlier this week, which is an ambitious 25-year cross-government plan to improve our health by improving our environment. And we took a lead in that strategy with the public health arguments, because health is a motivator for action right across the board. And instead of presenting it merely, important as it is, as an environmental plan, we presented it as a plan to improve people's health as well as get the environmental benefits. And when it comes to the two other big public health challenges of the next decade, obesity and mental health, in these cases too, personalization, more targeted interventions, and tailored support is how we get those marginal gains, how we succeed in the goal of helping people live healthier, happier lives. And this is how we start to do it. Starting in childhood, actually even before a child is born, genomics and AI can help us diagnose and treat rare diseases while they're still in the womb, so people are more likely to be born healthy. We can use predictive prevention to reach the parents who need help with infant feeding and nutrition. We can use opt-in data, and not just the clinical data and the genomic data, but the lifestyle data that we gain from, for instance, smart devices and wearables to identify which children need help with physical activity, who might be at risk of more mental health problems. Better data and smarter technology can help us get to them faster. But I know I can sometimes sound like I think that the data and the technology is all that matters. But the reason it matters is because we care about people. And we can't replace the people in the process. What we can do is empower people to make better decisions. Face-to-face human interventions will always be the most effective way to help young people, particularly with those children not lucky enough to be born into safe and loving homes. To give every child the best possible start in life, we need to fundamentally change the way we think about health, not that it's a problem to patch up when things go wrong, but that it's an asset, a foundation for each and every one of us to build on, something that we must protect and nurture, something society needs to invest in for every child, along with, in the same way we think about good housing, strong economy, well-paid work, these sorts of things. Because good health is what makes everything else in life possible. When we have it, we take it for granted, but when we don't, as Health Secretary, I've met many, many parents of seriously ill children, and it's clear there is nothing more painful than seeing your child in pain. And what's always at the forefront of a parent's mind is all the opportunities their child might miss out on as they grow up, all the things we take for granted. And being able to see health as an asset, something that must be nurtured even when it's going well, and preventing ill health and promoting good health, that is the way that we give every child, every person, the chance to fulfill their potential in life. And that must be our goal. It's both the challenge and the opportunity that we face in public health over the next decade. And I hope that this philosophy of seeing health as an asset can help to underpin our approach right across health and social care, the NHS, as well as, of course, as in public health. So, for instance, strong action to take excess calories, salt and sugar out of our children's diets, like the successful sugar levy on soft drinks has done. Strong action against manufacturers and advertisers so they can't bombard young brains with junk food messages. Tough action against social media and tech companies to remove suicide and self-harm content and tackle the spread of anti-vaccination propaganda. And even tougher action to stop Britain's opioid crisis becoming any worse. And I don't use that word crisis lightly. When 1 in 10 adults in England are on opioids, that is a crisis. Of course, painkillers have an important role to play, but the first duty of public health must be to protect the public, and we cannot afford to be complacent. We've all seen the devastation opioids have caused in America's heartland, and we cannot, and I will not let that happen here. And it's our job to prevent this problem from escalating. And on this, I want to say how extremely grateful I am to the work of Public Health England. Your recommendations, your evidence on painkillers and antidepressants and other prescription medicines, that will inform the actions that we need to take to tackle this head on. I think that the report that was published this week was incredibly important. It will mark a milestone in the attitude we take to over-medicalization. It was written in a way that was both assured and based on the science and the evidence, but also clear so the public could understand it. I think for many of us, it backed up our anecdotal understanding of what was going on, and it has put the evidence in place unambiguously that there is a problem that must be tackled, and tackle it we will. So take all these things together on children's diets, on social media harms, tackling anti-vaccination, opioids, and these all need to be led by national government. But I am well aware that that isn't enough. We can't tax and legislate our way out of childhood obesity. We can't tax and legislate our way to good mental health and tackling the mental health problems our young people face. These are part of the armory, yes, but they're no silver bullet. Because at heart at the heart of it, we're talking about changing human behavior. And if we want to change the way that people act, we need to understand the way that people think. And the department has polled people from across the country on prevention, from all age groups, all backgrounds, so we can really understand what the great British public think and what they expect from us. And there were two clear overriding messages for how we can push this agenda further. Firstly, the overwhelming majority of people believe that the responsibility for their health lies first and foremost with the individual and not the state. And I think this is a good piece of evidence to have found, because it's something that we constantly need to be reinforcing and empowering the individual to see their health as an asset and do the right thing by that. The second focus that we found is our efforts on prevention should be focused first and foremost on children. Sensible people in the British public, we should listen to them and we should make this our focus. I think what it proves to me is that if there is nannying to be done, then let's do it really well. And as a child grows up and the transition into adolescence and then into adulthood, we've got to be crystal clear with them. People are active participants in their own health. That's exactly how we should think about and treat the great British public. I don't like this phrase, the nanny state, because it invites critics who say that it is the individual who should be first and foremost responsible. But I'll tell you what I do like. I do like an active state with active citizens, all working with a shared responsibility to improve the nation's health. So personalised prevention means the government, both local and national, working with the NHS to put prevention at the heart of our decision-making. And working with you. I want to hear from you, your experiences, your ideas, the consultation in the Prevention Green Paper, which is open now and runs till next month, to make sure that we get this agenda right for the future. Because for prevention to succeed and to improve the nation's health over the next decade, everybody has an important contribution to make. Making healthier choices for ourselves and our families, eating well, staying active, being smoke-free, taking care of our mental health, laying the foundations for good health throughout our lives, investing in and building up that asset, which will allow us to live happy, healthy, and fulfilled lives. It's only working together that we can achieve this vision, only by treating health as a shared responsibility between an active state and active citizens. All of the constituent parts, all of you here, local authorities, national government, the NHS, communities, individuals, everybody who believes in the power of public health, everyone must play their part to get all those marginal gains. And that is the margin of victory, and how we can move from dealing with the consequences of poor health to promoting the conditions for good health. And ultimately, that's how we'd finally make the NHS a national health service, not just a national hospital service. Because ultimately, we're all on the same team. And whether it's Team GB, it's a Team GB that's there for everyone, for every child growing up, everyone treated as the individual that they are. That is the future I see for public health. And that's what I believe we can achieve if we work together. Thank you very much.
So thank you, Secretary of State, and you've just about covered perfectly our agenda here over the past two days. There are now 34 days, 35 days yesterday, 34 days to the closure of the consultation, the Green Paper. We have the opportunity to put questions to the Secretary of State, and I'll just see who we have in the room. Yes, what we'll do is we'll take two questions and then see how we get on. So, first question on the third row. Thank you. Could you just say who you are?
Yeah, Ruth Tennant. I'm the Director of Public Health for Solihull. You started your speech by talking about bigger, better, fit for the future, and actually for the likes of me, so the jobbing directors in local government, our bigger, better, fit for the future is really how we use all those toolkits in local government with our local politicians, so economic development, regeneration, green agenda, which is hugely exciting and where we know the kind of longer term gains are going to come from. I think a lot of us are working through how we plug all that into integrated care systems and having really interesting conversations with NHS colleagues about how we actually think about health as a system that really brings all those factors into play. So I'd be really interested in your views about how we can work with you on that and work with NHS colleagues to really, really drive that.
Yes. Can I take this question? I'm terrible at 2 questions at a time because I always forget one or the other of them and get too enthusiastic about answering one. This is a brilliant question, and I'm going to add a third, which is the tougher bit that you didn't mention, which is, of course, the resources, which I was kind of waiting for at the end of the question.
I think it's coming.
But I might as well answer it anyway. Look, this is exactly the approach that we should be taking. As everybody in the room knows, in the long-term plan, the NHS, which the NHS proposed, they included looking at the responsibilities for where public health should lie. We did look at those, and we concluded that it's absolutely brilliant what councils have been doing, especially the best councils. By their nature, councils do things differently. I see that as a positive, not a negative, because we find out all sorts of interesting ways to improve the delivery of services and learn from each other. It does mean we've got to bring the laggards with us and make sure that best practice is spread. But the central reason why the move was made 5 years ago in the first place has been borne out, which is that public health isn't just about the public health grant, it's about ensuring that the whole of a council's responsibilities are brought to bear on improving the health of the locality. And I think you put it better than I ever have been able to. What I hope that we've done in the public spending round, crikey, was it only last week?
It was last week.
Last week, is brought to an end the period in which that was having to be done under a shrinking budget. And the budget is now growing in real terms, but I'm not promising that I'm not saying that it was a great showering of resources, but it was the first progress in the right direction for some time, and I'm very pleased about that. And I hope that the fact that that people can concentrate not just on managing the very tight resources, but also onto the positive agenda, exactly as you described. I hope that can now happen, and we are trying to tie in with the approach we're taking nationally, both the department, cross-government, the other non-DHSC policies that obviously have a bearing, and through supporting PHE to really empower you as much as you can and your colleagues around the country to do the very best possible.
Thank you. That's a second question just here. Yes.
Matthew Ashton, Director of Public Health for Sefton. There appear to be some differences in approach between your vision for health and social care and the one taken by the Treasury. So, for example, the sugar tax levy, first year of that money came back out into communities, into sporting activities. The second year, I think those monies being retained by the Treasury. Also, your vision around smoke-free by 2030, incredibly important message. Some of the narrative coming out of the Treasury is around post-Brexit and duty-free ability of our communities to access cheap booze and fags, and how great that will be. How can you...
I saw that tweet.
How can you get your vision for public health and prevention across the whole of government, including Treasury, and how can we support you to do that?
Yeah. Well, look, we've got to keep winning this. We've got to keep winning this argument. I don't think that the return of duty-free was really seen from within a public health context, should we say, before publication, and certainly I didn't see it before publication. But leave that one with me. But on the first part of your question, there was a proposal that when the soft drinks industry levy, as it's technically called, was introduced, that the money should be hypothecated into sports and activities. Actually, we decided to have a set budget moved across from the revenue to the sports and activities. And that's a good thing, because the impact of the soft drinks industry levy has been to increase reformulation incredibly. It's been a very, very successful intervention. One of the results of that is that the revenue it's raised has been much lower than previously anticipated, but the Treasury have not reduced the grant on the other side because it wasn't hypothecated, and this is a good thing. So I don't recognise the idea that the money's reduced on the other side. It hasn't. That's been maintained, but we have seen a reduction in the amount of revenue because industry has responded to the incentives that are inherent in the tax. So the tax has been successful. We always said that we'd have a review of the evidence on what to do next. The Treasury have always promised to do that next year. We'll be feeding into that evidence base, and I'm working with Duncan on making sure that we get that evidence base together.
Thank you. Gentleman in the bright shirt.
Hello there.
Not just a bright shirt, a bright jacket. It's actually fantastic.
Another DPH, I'm afraid. Darryl Gale, Director of Public Health, East Sussex County Council. I really welcome your renewed focus on vaccination. In local government, obviously, we have very close access to people like head teachers, school governors, the school system, etc. And I'm really wondering what kind of vision you have for the role of local government in improving the uptake and rates of vaccination.
Great question. I think you've got an incredibly important role. This is a really serious problem, the drop-off in vaccination rates. Let's not overdo it. We're still one of the best in Europe, and it's still high by international standards, but the fall has been very alarming, and we've now seen the impact of that fall in terms of the WHO removing the UK's measles-free status. So I'm determined to do everything we possibly can, and it's another area where local government, because you've got boots on the ground and you're closer to what happens on the ground. Now, there have been suggestions, including this week by MPs, that we should say that you can't take your child to school if they aren't vaccinated, and I previously said that I wouldn't rule out that approach. I don't think the time has yet come, and I hope that we don't have to take that step, which several states in America and France and Germany have taken, not least because I worry that the very children who you'd be, I don't want to use the word targeting, but who would be impacted by it are exactly those who need our support most, actually. So there's a wider social justice question that would have to be addressed. But nevertheless, everything that you can do to drive that agenda, and if there's link up that we need to make sure that our national anti-vaccination work and your work locally is better coordinated, then including with DFE, then I'm absolutely up for that conversation, and let's take that up.
Yeah, it's a huge opportunity. Directors of Public Health know their communities, they know how to get things done, they know the families, they can really make a difference. So the vaccination strategy is our opportunity to get all that bound
let's
together, to do that together.
Very good.
I think we've got just a moment. May I, do you have where are we? Oh yeah, gentleman in the middle, and then I think just one further question to the right here.
Councillor Ben Stokes from South Gloucestershire. I'm also the chair of the South West Lead Members Adult Social Care Network.
You play cricket as well.
I've heard that one. Now,
Yeah.
I'm just very conscious about STPs and getting money flowing around STPs.
Yeah.
And the overriding experience across the South West region is where you have an STP with struggling acute The money question is always around making the acute work, and prevention just never gets the proper recognition on the agenda, and money is not flowing in those scenarios.
Yeah.
What are your views on STPs and getting money moving?
So the STPs are an absolutely critical part of moving to a population health-based approach, so that we are not just have the NHS as essentially a national hospital service, they are but the starting point in many cases are acute trusts that have financial difficulties. The purpose of moving from an STP to an ICS, with apologies for the number of TLAs, is to try to embed that approach with local authorities legally required to be invited to be on the board, to make sure that the local authorities and the public health responsibilities and, of course, social care responsibilities are brought to bear in that relationship. Now, I think that it's only by doing that we can move to having a population health-based approach. We have not yet made that change within the NHS side, which means that the financial incentives are not yet fully embedded to be able to take a more preventative-based approach. So what I would say is essentially it's early days. I think this is part of a solution to the problem, even though it currently manifests itself as a problem. There's some innovative approaches. For instance, in Cambridgeshire, where the STP budget is dominated by the budget of Addenbrooke's, which is obviously a very significant hospital, and the deficit is being dealt with. They are being very innovative in terms of how they get the financial incentives on the STP to all support solving the problem the financial problem at Addenbrooke's by essentially prevention and keeping people out of hospital. It's quite hard-nosed because a lot of people, it hits other people's budgets then, but it certainly makes this whole system think we've got a collective problem. And both that the hospital can't just suck in all the resources forever from all the other services, which is exactly the concern you raised, but also that all the other services need to make sure that they do what they can and are funded to do what they can to keep the pressure off the hospital. So you get into quite complicated financial incentives in the system to get this right. It's incredibly important that we do, and I'd be very happy to hear more about your specific concerns locally and why that's gone wrong, to be able to understand how we structure this properly, because ultimately, by giving a local area that has responsibilities for public health, primary, secondary care, and social care together, if people get to the point where they genuinely, collectively feel are responsible for that population budget, we're going to have much better incentives than in the current tick-at-the-turnstile tariff system that we're moving away from.
I mean, this is exactly what we need to work on together. One final question from...
another DPH, I'm sorry.
Are there any non-DPH?
There's one or two. I think our collective noun
Three
is...
hands.
I think our collective noun is either a resilience or an annoyance this morning, depending. I'm Jim McManus, Director of Public Health for Hertfordshire. We have a public health partnership in Hertfordshire of 11 councils, 10 districts, 1 county. And we know we can do stuff the NHS can't. And I'm excited listening to you about how the things that we can do, our capabilities, can balance the things that the NHS can do and the things that you're explaining. So one of our districts who's here has a fabulous hoarding project. Another takes people out of hospital and rehabilitates them to walk. And a third actually has a social enterprise that takes people off opioids and gets some jobs in the furniture industry.
Right.
So how can we work with you to unleash our capabilities in a way that the NHS and us together can be much more than the sum of our parts?
Yeah.
Because that's what's exciting me this morning.
Yeah, that's a great question, and really that is That's the functional question of how we put the agenda that you've been discussing, that I tried to articulate a little bit, into practice. And I think it can only happen by local authorities looking out to see best practice, by the LGA playing their incredibly important convening role in getting that learning, by us at a national level ensuring that the financial incentives that are imposed work with the flow rather than against the flow of this approach, and of course Public Health England holding the ring and doing what needs to be done once nationally. So I'm up for that. That architecture is getting that sort of high-level governance architecture is incredibly important, and I'm very excited about the agenda.
So for my part, I can't sufficiently convey. I did yesterday in my opening remarks about your personal commitment to prevention, the work we did together on the long-term plan for the NHS that has prevention as its heart, and of course the Green Paper, and then the arguments that you've done, what you can do through the spending review at this stage. So in this room and the hundreds of others that are listening into this, you have an army that's there to do
Can I say
everything.
one more thing about the Green Paper? You mentioned the Green Paper. The Green Paper was put out at a time of political sensitivity. And I'm really looking forward to the response of it, because you know, this prevention agenda is absolutely mission critical to the future of all health services in the country, the NHS and public health services, and we've got to get it right. There was some handling that was done at that time to try to make sure that the agenda retained its support across the board, and it's at the moment that I really want your responses, and then when we respond to that the Green Paper, we will march forward together.
Right. Thank you very much. Thank you.